Hello, friends. How are you? I hope you are fine. So, today I'm going to read the Indian Express article on explain page. So, here we go. So, what is the Delta variant of COVID 19 and why is it a concern? Multiple SARS-CoV-2 variants are circulating globally. One of these is the B.1.617 lineage detected in India earlier this year. What is the Delta variant of COVID-19 and what makes it variant of concern? In its latest risk assessment for the SARS-CoV-2 variants, Public Health England has said a staggering 61% of the sample sequence are now of the Delta variant, that is B.1.617.2. This means the Delta variant, first detected in India, is more dominant in the UK than the Alpha variant that had last year triggered a surge in the UK. So, what is the Delta variant of COVID 19? Multiple SARS-CoV-2 variants are circulating globally. One of these is the B.1.617 lineage detected in India earlier this year. Early evidence suggests that it's a sublineage B.1.617.2 known as the Delta variant is more transmissible than contemporary lineages. The World Health Organization, that is WHO, which has given it the label Delta, has categorized it as a variant of concern VOC. It has said it continues to observe significantly increased transmissibility and a growing number of countries reporting outbreaks associated with this variant. WHO classifies a variant as a VOC when it is associated with an increase in transmissibility or detrimental change in EU COVID 19 epidemiology, increase in virulence, or decrease in the effectiveness of the public health measures or available diagnostics, vaccines, therapeutics. What makes the Delta variant a VOC, virus of concern, right? So different variants are characterized by mutations or alterations in the virus genetic material. An RNA virus such as SARS-CoV-2 is made of about 30,000 base pairs of amino acids placed like a bricks next to each other. An alteration in any of these base causes a mutation, effectively changing the shape and behavior of the virus. The Delta variant contains multiple mutations in the spike protein. At least four mutations are important. One of these is called L452R, first reported in Denmark in March last year. This mutation has been found more transmissible than wild type strains and also been associated with the reduced antibody efficacy and reduced neutralization by vaccine sera. The mutation P681R has been associated with the chemical processes that may enhance the transmissibility, PHE says. The D614G mutation was first documented in the US early in the pandemic, having initially circulated in Europe. There is evidence that variants with this mutation spread more quickly. The Centers for Disease Prevention and Control CDC says. Another mutation in Delta is T478K. This was present in the around 65% of the occurrences in variant B.1.1222, first detected in Mexico last year and associated with the higher effectivity. Infectivity. What is the evidence so far on transmissibility? Public Health England said Delta continues to demonstrate a substantially increased growth rate compared to Alpha across multiple analyses. In the week beginning May 17, PHE analysis of genome sequencing data in the UK found that 61% of the cases are Delta. Delta cases are rising while Alpha cases are declining. Also, PHE said secondary attack rates have remained higher for Delta than Alpha. What is the evidence on severity? PHE said early evidence from the England and Scotland suggests there may be an increased risk of hospitalization compared to the contemporaneous alpha cases. A large number of the cases are still within the follow up period. In some areas, hospital admissions show early signs of increasing, but the national trend is not clear, it said. How effective are vaccines? The PHE says there are the analysis from England and Scotland supporting a reduction in the vaccine effectiveness for Delta compared to the Alpha. This is more pronounced after one dose. Iterated analysis continues to show vaccine effectiveness against Delta is higher after two doses, but that there is a reduction for Delta compared to Alpha, it said. On Friday, a paper in the Lancet said adults fully vaccinated with the Pfizer BioNTech vaccine are likely to have more than 5 times lower levels of neutralizing antibodies against the Delta variant than against other variants. In the longer term, we note that both the increased age and time since the second dose of BNT162b2 significantly correlate with the decreased NAB activity against B.1.617.2 and B.1.351, both of which are also characteristic of the population in the UK at highest risk of severe COVID-19, the study states. Is the Delta variant associated with the reinfection? The latest analysis of 874 cases of reinfection in the UK shows that 556 were of the Alpha variant and only 96 were with the Delta variant. During the period of time that a Delta became prevalent, there has been no increase in the PCR positive participants in the cohort overall, and reinfections remain at very low numbers in individuals previously either PCR positive or seropositive, the PHE said. Thank you.